Good morning to everyone. So glad that we've all joined together here in the great city of Costa Mesa. So welcome this morning. My name is Michael Hunn, and I am the Chief Executive Officer at Optima Health, the Medi-Cal health plan here in Orange County. We provide insurance to just under 1 million people here in Orange County. We're very proud of the work that we do each day in service to our community. And on behalf of our board of directors, we are very pleased to welcome you here this morning. Our board chair is here this morning. Chair Becerra, if you'd please stand up. A little round of applause. We want to thank our board for the incredible support that they have given to the street medicine program. This is a vital program, and this will be the second city in which we launch street medicine. We want to thank certainly all of our essential partners and those in collaboration. And I want to begin by thanking one of the most amazing advocates I've come to know, Supervisor Katrina Foley. Supervisor Foley is going to speak this morning, followed by Kelly Bruno Nelson. Kelly is our Executive Director of CalAIM and oversees the work that we do in this street medicine program. None of this happens without dedicated staff and the partnerships that we have with both the electeds, our board, the community, the cities, our medical care providers. All this goes together to create something really quite extraordinary. In addition, we have to have a keen partnership with the city in which we launch street medicine. I tell the cities all the time, I have to see green lights all the way down the track. The mayor, the city council, the city manager, fire, police, community folks, the liaison officers for homeless care. Everyone has to be in agreement that this is something that is wanted and embraced by the city. As it is embraced, so it becomes successful. And we are very fortunate to have a city like Costa Mesa that has fully embraced the launch of street medicine here. So I particularly want to thank today the city manager, Lori Ann Farrell Harrison. Thank you so much for the great support you have given us for this program. As part of our comments today, we'll hear from the CEO of Celebrating Life Community Health Center. And I would particularly want to thank the Fire Department Chief Dan Stefano and also the Police Chief Ronald Lawrence for their support. Without it, we are not as successful. Please thank both of those fine gentlemen. And now I'm going to turn it over to our Chief Operating Officer, Yun Young Kim, also known as YK. And I'll bring this down just a little bit. We're a little bit different altitudes.
Thank you, Michael. Good morning. I'm Yun Young Kim, Chief Operating Officer for Optima Health. I just wanted to take a moment to just say how proud I am of the work that we're doing together, all of us here in this room and also in our community, and how that reflects on the lessons that we've learned from our early success in Optima Health Street Medicine program. This is a young program. Our program actually only launched 16 months ago in the city of Garden Grove. And since then, more than 315 unsheltered individuals have been served by this program. We're really proud that 12 of those individuals have been permanently housed, which is really the goal. We are looking to put ourselves out of business, to not have a street medicine program in the future. I want to just highlight one of those individuals. His name is Wyatt. He was profiled actually during a CBS segment about our Garden Grove program. Due to the guidance and support that he received through our team, through our shared team, he is now housed for the first time in 50 years. Wyatt's story is amazing. I know he is grateful, and we are grateful to have been part of his journey with him. I think we all look forward to similar positive results here in Costa Mesa because we know what works. We know that alignment and partnership amongst all of the parties, that's the secret sauce to this program. Our city leaders, police, fire, provider, and Cal Optima Health, and again, our broader community together. That's what makes this program work and makes it successful. The room here represents that partnership, represents that alignment. I want to say on behalf of Cal Optima Health's members, the members that you will serve, the families and the lives that you will change here together in Costa Mesa, thank you for being partners with us. Thank you for being here with us today. And now I will turn it over to Supervisor Foley.
Good morning, everybody. I'm Katrina Foley, your County Supervisor, representing the fabulous 5th District. And the 5th District, as many of you know, is right here in Costa Mesa, where I live, all the way to San Clemente, picks up 31 miles of our beautiful coastline, has a diversity of community interests, and we have people living here who are living in $30 million homes and people who are living unhoused. And so the challenges of representing a district like this require partnerships with the city of Costa Mesa, partnerships with Cal Optima, partnerships with all of our local nonprofits and our healthcare providers. And I think that this new street medicine program here in Costa Mesa is going to give the city of Costa Mesa the added oomph that it needs to really take the next step in helping the unhoused become housed. Because as we know, housing is healthcare. And when we first started our bridge shelter in 2018, it really started because of this location right here. I traveled with then police officer, Chris Cover. We went over to the park, and it was fully encamped with individuals. Children couldn't play in the park. I always wear flip-flops or sandals, and officer told me, "Mayor, you can't be in the park in your flip-flops." And I said, "Why?" "Well, there's needles in the park." And so that to me was just unacceptable. It was unacceptable for the community. It was also unacceptable that we were allowing people to literally degrade in our park. And so we as a council, with the leadership of our city management, we took the lead and we built a temporary shelter. We had the community support and buy-in, and that's what is critical. And I understand, and I know the city manager will correct me if I'm wrong, but we've since housed about 362 individuals out of that shelter. That's 362 individuals who are no longer living unhoused in our community. The goal for the street medicine program here with the partnership with Cal Optima is to address the 150 people that have been identified living homeless, and that we can identify and connect 150 people with a primary care physician, with a caseworker, a housing manager, with permanent supportive housing. The goal is to get people housed, but along the way to take care of their significant health needs, because we all know that anyone living unhoused has a terrible, terrible life experience. Maybe they didn't have any kind of mental health issues before they became unhoused, but living on the street day after day and enduring the kinds of things that they're enduring may have caused a different mental health crisis for them. Maybe they need addiction and substance use supports and treatment, and we'll connect them. So I'm just really grateful. I'm excited about learning about the Garden Grove stats and how successful this program has been in Garden Grove, and I think it'll be even more successful here in Costa Mesa with the supports of our police and fire and our already existing system of care that is really, I think, innovative and a model for other cities in the county and throughout the state of California. We all know the governor has directed that if counties and cities do not help people get housed and help people get treatment, that he's going to start reducing funding to those areas. We do not want to be in that situation. We have a lot of innovative programs here in the county. Our system of care is being built out. As your Orange County Housing Finance Trust Chair, I am committed to making sure that we build more permanent supportive housing so that those individuals that Cal Optima is able to connect to have a place to go. and we get people the housing that they need and the dignity that they need. So thank you all for taking this chance. Thank you, City Manager Farrell Harrison, for leading this effort, and thank the mayor. I think he wishes he could be here. I know that he is committed to this cause, but yes, it's immoral for us to turn a blind eye and not help to house people. So thank you for caring. Thank you.
Tonight, over 4,000 people across Orange County will sleep in public places because they lack the private places to do so. They'll huddle in public parks, pitch tents below highway underpasses, or sleep in their car or an operable camper. These are our unhoused neighbors, and every day they struggle to live. People experiencing unsheltered homelessness must focus on survival and obtaining the basics of life, making taking care of their health a distant priority. Now, attempts have been made to prioritize and to provide health care to the unsheltered, but most do not accommodate the realities of life on the street. And when these attempts fail, and they do, and that unsheltered person doesn't fit neatly into our existing healthcare system, we label them as service resistant, reinforcing the belief that the person is the problem, not the system. But here in Orange County, we're fixing the system with efforts like Optima Health Street Medicine Program. Designed with the person, not the system, at the center, our street medicine program meets our unhoused members where they are and brings ongoing primary and social care directly to them. A medical care team cares for their health needs, while a team of peer navigators with lived experience cares for their social needs by providing housing navigation and enhanced care management. This whole person trauma-informed approach builds rapport first, enabling care next. Increased access to primary care is an important outcome of the program, but as YK said, there's no more powerful medicine than housing, and that is why connections to permanent housing is ultimately our goal. As Supervisor Foley so well said, housing is health. We piloted our street medicine program in Garden Grove in April of last year, and while it is still early, the results have been very promising. With more than 315 unsheltered individuals have been served by the program, with 95% of those individuals actively enrolled in both ongoing primary care and care management support. But even more impressive is 12 individuals in the program, 12 worthy human beings who were earlier labeled as service resistant, have transitioned from the street to permanent housing. Today, we are super excited to build on that success and continue to fix the system by expanding our program to the great city of Costa Mesa. Celebrating Life Community Health Center will be the street medicine provider, and over the next 18 months, their team of doctors, nurses, social workers, and peer navigators will build the program and provide medical and social care to 150 unsheltered residents here in Costa Mesa. And I am confident with these two amazing partners, we can expect the same transformational results. So on behalf of Optima Health's Board of Directors, our 1,600 employees, and almost 1 million members, I would like to sincerely thank the City of Costa Mesa and Celebrating Life for your partnership and dedication to bringing street medicine to our unhoused members. We are truly better together. And now I would like to introduce Lori Ann Farrell Harrison, the City Manager for Costa Mesa.
Very excited to be here today. This is just a fantastic show of support, of love, of compassionate care for the least among us. It is a privilege to be the City Manager for the great city of Costa Mesa. And today, on behalf of our mayor, who you will hear from shortly in a video after I make some brief remarks, and our city council, and all of the employees that work tirelessly to help every single resident in Costa Mesa, but in many instances give extra effort, extra support to those that are unhoused. I just want to thank everyone for being here today, and I want to thank Optima. I want to thank Celebrating Life for this incredible partnership. This partnership is truly going to change and save lives. As many of you know, we talk a lot about equality, we talk about equity. This is a perfect example of what equity means. Equality in government is about, and in business, in the private sector, it's about opening doors and welcoming everyone, regardless of their race, their gender, their sexual orientation, and saying, come one, come all. Equity goes a step further. Equity initiatives, and I'm going to say that this is an equity initiative, recognizes that there are barriers to access that some communities face, that some individuals face, either due to past conditions or due to present conditions. When we have equity in public policy, we take a step back and we say, who's missing? Who's missing from our urgent care facilities? Who's missing from the primary care? Who's missing from having regular OBGYN visits? Who's missing from seeing a cardiologist or an endocrinologist when they have diabetes or they have heart issues? It's our unhoused that are on the street. Street medicine brings it to them. It recognizes that we have individuals living in our community that are unhoused, that are struggling with basic necessities, the next meal, clean clothes, access to water to be able to take a shower or a bath, trying to get housing, maybe some mental health along the way if some of our street outreach workers can access them. And so getting access to healthcare is probably a lot lower on the list than some of the very basic day-to-day necessities of just surviving, not thriving, but surviving. For those of us who have the luxury of having health insurance, it's for me, it's a decision of just timing and priority. When do I book a visit? I don't feel intimidated to go into a doctor's office, but that's not necessarily the case for many of the individuals that are unhoused, that are dealing with very complicated issues when they're living on the street and need our help. And so I am so excited about the street medicine program because I know it's going to reach the hardest to reach, those that have been what some call service resistant. And turns out they're not service resistant after all, as we're seeing. It's providing the right service at the right time to the right person. And so in bringing street medicine to the community, I'm just so excited that Costa Mesa is going to be one of just 3 cities that have partnered with Cal Optima on an initiative this bold. Costa Mesa believes in helping everyone and being compassionate. As Supervisor Foley mentioned, we have a 100-bed shelter in Costa Mesa. We don't believe in whining about our issues. We actually are problem solvers. We have a 100-bed shelter in partnership with Newport Beach. We have given $2 million in rental assistance to prevent people from becoming homeless. And so we have different pistons going at any point in time to help address this issue. We have an affordable housing agenda that's pretty robust. We are in partnership with the state and the county as well on Project Homekey and motel conversions. And so street medicine is going to be that one additional piece to really get to the individuals that need it the most to help them be able to access housing and have a happy, healthy, and productive life. And so I am just so excited on behalf of our team. I want to thank Nate Robbins. I received a lot of accolades about this program. That wasn't me, that was Nate. And so Nate, will you just stand so we can give you a robust round of applause? Nate told me we were doing this. And just like Michael Hunt said, I got out of the way. It was green lights, I got out of the way, and I'm just so glad that we're here. And so thank you to our team at our shelter. John Began is here. We have street outreach workers that are out there, boots on the ground every single day, understanding what the needs are of our unhoused population so that they can come into the shelter and get care. And now there'll be this beautiful partnership with street medicine and our street outreach workers, our shelter, and really being able to get the folks that need it the most. And so I'm just really, Nate, thank you for your vision. Thank you for being the front line on this initiative for us and being so compassionate yourself. John, thank you to you and your team and our street outreach workers. And police and fire for always being there and also being yet another partner that's really integral to making these connections and helping to save lives. And so with that, I'm going to turn it now to our incredible mayor, John Stevens, who's a huge advocate for every single member of our community, has been a major supporter of all of these initiatives to prevent people from becoming homeless, but if they do, providing the services that are needed to get them back on their feet as quickly as possible in as many different ways as we possibly can. And so now we have a video from him.
Hello, everybody. My name's John Stevens. I'm the mayor of the great city of Costa Mesa. And the city of Costa Mesa is so happy to be partnering with Cal Optima in the street medicine program. I'm proud that we're one of 3 cities in Orange County that participates in this program. And when you think about what we're going to do here in this initiative and the work that we're going to be doing in partnership with Cal Optima, it's providing just basic health care for people that are vulnerable that need it. And what could be better than that? Health. The other thing is we're going to be meeting people where they are and with what they need, and hopefully getting them into housing and getting them the other services that we offer in our bridge shelter. This is a great thing that we're doing for the community. You know, I'm not sure a lot of people know this, but one of the core values of the city of Costa Mesa set by the city council is compassion. And this program is right on the mark with that core value that we have. I'm very proud of the city staff. I'm proud of the city council that voted for this, and I'm thankful that Cal Optima, Katrina Foley, and our partners at the county are working together to keep people healthy and housed in the great city of Costa Mesa. I wish I could be here. I'm on one of my few vacations that I ever take, but thank you for doing what you're doing. Have a wonderful kickoff, and thank you for the work that you're doing.
Round of applause for our great mayor. And then next, I'd like to introduce our incredible partner at Celebrating Life, Sergey Sergeyev, who's the CEO of Celebrating Life Community Health Center and is actually going to be the organization actually providing the street medicine in the great city of Costa Mesa. So I'll introduce Sergey.
I am deeply honored to speak on behalf of our wonderful organization as we embark on this journey to provide street medicine and housing navigation in the wonderful city of Costa Mesa. Allow me to share my personal story. As a refugee, I have experienced the uncertainty and pain of not having a place to call home. Homelessness is not just about living on the street. It is about the struggles, the unknowns, and the many challenges that comes with it. This personal connection to the issue is that fuels our commitment to the mission. My team, many of whom have similar lived experiences, have walked the difficult paths, and now we are committed to walk alongside those who need our help the most. Street medicine works. Street medicine is not just a theory or fairy tale. It is a proven solution. We want to be a part of this street medicine because we believe in its transformative power. It is not just providing care on the street. It is about building the trust, offering hope, and paving the way to permanent housing. It reaches people where they are and addresses their immediate health needs and connect them with the resources to move them off the street and into stable housing. We are deeply honored to be part of this proven solution to address homelessness with collaboration with Optima Health, City of Costa Mesa, its police and fire departments. This partnership reflects a unified commitment to addressing homelessness in the community. We look forward to sharing our progress and successes with you in coming months. Together, we will work tirelessly to ensure that those who are without homes are not without hope. And they will receive the care and support and need to rebuild their lives. Thank you for serving this community. I just want to give a moment if my team, who is in orange t-shirts, to stand up and give them a round of applause because they are the one who is going to be on the street and provide this wonderful service. Thank you.
All right, what an exciting day it is to be a member of the Costa Mesa community. As Cal Optima, in partnership with Celebrating Life Community Health Center, has launched the city's first ever street medicine program. And And while street medicine might be new to the city, as Sergey mentioned, it is a proven and powerful tool that has changed the lives of countless people experiencing homelessness worldwide. To exemplify the impact that street medicine can have, I'd like to share a story with you from my experience working as a street medicine provider in the San Francisco Bay Area. My team was called by a partnering organization to seek out a patient who we will call Tom. Okay. We received word that Tom was living under a bridge behind an encampment and that he had sores all over his body. So we hopped in our van, we located the bridge, we traversed on foot down a hillside, we yelled out Tom's name, peeked out from behind the curtain, and there he was. We then started to talk to Tom, and I took one look at his arms and legs, and it was very apparent to me that Tom had something that we call MRSA, okay, which is a highly contagious bacterial infection that can be very difficult to treat. As we were treating and tending to Tom's wounds, he started to open up to us. So we sat there and we listened intently, without judgment, as Tom told us his life story. And Tom had a lot to say. After we were done tending to his wounds, we gave him the appropriate antibiotics, we gave him wound care supplies, snacks, and of course socks. If there's one thing I've learned from working in street medicine, it's to always have socks. Okay. After that, we connected with his case manager to discuss the next steps in his housing process. Fast forward 2 months, Tom was now housed at a shelter. He was working on his sobriety and his substance use. His lesions had healed up nicely, and he continued to engage in care. Right? This is the impact that street medicine can have. Breaking down barriers for the unhoused, building trust with them, and helping them to become healthy and housed. And as we saw with Tom's story, it is imperative that we have collaboration between various organizations that are dedicated to serving our community's most vulnerable populations. And we certainly have that here. We certainly have that here. From Cal Optima in Celebrating Life, to the fire department and the Network for Housing Solutions, as well as the new kids on the block whose spirits shine brighter than the uniforms that we wear. We have passionate teams in this community who are ready to change lives. So thank you very much for this opportunity. I'm oh so honored. And I can't wait to continue to get out into the community and make a difference. Thank you.
We again want to thank everybody for coming today. I particularly want to thank all of our colleagues at the media for coming to cover this. I think it's so important to tell the story, and stories are so critical. And imagine the stories we're going to get to tell within the next year of the lives that have been touched by the incredible work here. Thank you all for the great work that you do each day. Let's go forward. Thank you.